Hello friends, welcome back to my channel. This video is my 20th notebook of medicine subject for NEET PG exam. Mitral regurgitation shows pan-systolic murmur. Aortic regurgitation shows early diastolic murmur. Mitral stenosis shows mid-diastolic murmur with opening snap. Aortic stenosis shows ejection mid-systolic murmur with systolic ejection click. Tricuspid stenosis shows mid-diastolic murmur with A wave. Young man came to medical OP with complaints of early morning backache and stiffness, which improves on exercise. There is persistent red eyes. On examination, there is expansion of lung less than 3 cm. X-ray shows bamboo spine appearance. Diagnosis is ankylosing spondylitis. A patient, he had potassium level elevated urea level, and patient was on dialysis. At the end of dialysis, patient was drowsy. He had sudden seizure episode. On examination, patient was hypotensive. Treatment is IV mannitol. Diagnosis is dialysis equilibrium syndrome, which is also known as reverse urea effect, for which IV mannitol was given. Next is 50-year-old HIV patient. He had painful lesion of violaceous growth on hard palate. Diagnosis is Kaposi sarcoma caused by human herpes virus 8. Next case is a patient was brought to OP by his wife. Patient had complaints of difficulty in expressing emotions and not taking part in daily activities. On examination, resting tremors as well as rigidity was present. Diagnosis is Parkinson's disease, which is also known as paralysis agitans, which is due to degeneration of substantia nigra in basal ganglia. Next case is a female patient presented with severe restlessness as well as palpitation, and also she had tremors. Patient is a known case of bronchial asthma. Neck looks like swollen. BP is elevated. Tachycardia present. ECG showed atrial fibrillation. Diagnosis is thyroid storm or thyroid crisis with atrial fibrillation. Drug of choice is immediate treatment with diltiazem, which is a calcium channel blocker. Next case is 30-year-old male patient, HbSAg positive, HbEAg positive, is diagnosed with chronic hepatitis B. Viral load of patient is 2 into 1 lakh. SGPT is doubled. Treatment is tenofovir for more than 40 weeks. Next case is 25-year-old male patient, complains of palpitations, sweating as well as restlessness. Complaints of sweaty palms were present. Diagnosis is Graves' disease. Diagnostic finding is increased level of thyroid receptor stimulating antibody. On histopathological evaluation, follicular hyperplasia with scalloped margins on biopsy. Treatment of Graves' disease is propyl thiouracil as well as radioactive iodine. Next case is 45-year-old HIV positive male patient, complains of persistent cough, weight loss, as well as skin lesions like umbilicated papules and nodules on face, trunk and upper extremities. Chest X-ray showed multiple bilateral nodular infiltrate. His sputum showed CBNAT4-TB, which was negative, low CD4 count. Diagnosis is HIV with disseminated histoplasmosis. 40-year-old female patient had complaints of chest pain, palpitation, shortness of breath. On examination, there was mid-diastolic murmur as well as prominent A wave, which was found on JVP. Diagnosis is tricuspid stenosis. ECG finding of tricuspid stenosis include right atrial enlargement, which includes tall peaked P wave in lead 2 and prominent upright P wave in lead V1. Next case is a male patient came with complaints of seizures, history of fever, headache, confusion. MRI brain was done which showed inflammation involving bitemporal lobe. Diagnosis is encephalitis caused by herpes simplex virus. Investigation of choice is HSV DNA in CSF by PCR. Next case is a male patient who had sensory loss, weakness of limbs for 3 months. Patient has angular stomatitis. On examination, there is loss of proprioception, vibration sensation, as well as absent ankle reflex. Patient had UMN type of lower limb weakness. Diagnosis is subacute combined degeneration due to vitamin B12 deficiency. Treatment is replacement therapy with 1000 microgram of intramuscular vitamin B12 repeated at regular intervals or by oral vitamin B12. Causes of mid-diastolic murmur includes mitral stenosis, tricuspid stenosis, atrial myxomas, Austin-Flint murmur in severe aortic regurgitation, Carey-Coombs murmur in acute rheumatic fever. Next case is a patient who is a known cause of hypertension, was on multiple antihypertensive medication, came to OPD. ECG finding showed tall T waves. Diagnosis is hyperkalemia. Drug causing hyperkalemia is spironolactone. Next case is a patient came to OPD with complaints of polyuria. History of undergoing total hypophysectomy is present. Sodium level is 155 milliequivalents per liter. Urine osmolarity is 200 milliosmol per liter. Diagnosis is central diabetes insipidus. Definitive treatment is lifelong supplementation of desmopressin. Next case is chronic alcoholic patient came with acute pain and swelling of left great toe. No history of trauma. Synovial fluid analysis showed increased leukocytes. Lab investigation showed normal serum uric acid level. Diagnosis is acute gout. Next case is 78-year-old female patient presented with progressive decline in daily activities, gives history of convulsions as well as visual hallucination, does not talk to anyone and keeps looking at sky. Pathological examination showed Lewy bodies within neurons. Diagnosis is Parkinson's disease. Gold standard treatment is levodopa and carbidopa or levodopa and benserazide. Carbidopa and benserazide, these both are peripheral decarboxylase inhibitors. Next case is 65-year-old patient who is a chronic smoker came to medicine OP with complaints of upper chest discomfort and drooping of eyelid. Patient complained of pain radiating to upper arm and tingling sensation in 4th and 5th digits of his right hand. Chest X-ray showed local extension of tumor growing in apex of lung involving C8, T1 and T2 nerve roots. Stellate ganglion was present over the chest wall. Diagnosis is Pancoast tumor, which is also known as superior sulcus tumor. Treatment includes chemotherapy by cisplatin or etoposide along with radiotherapy, that is 45 gyrin over 5 weeks. Other treatment methods are thoracotomy, en-bloc chest wall resection, lobectomy, chest wall with reconstruction. Next case is patient with diabetes mellitus for past 5 years. Patient had vomiting as well as abdominal pain. She is non-compliant with medication and she is dehydrated. Investigation done showed blood sugar value which was 500 mg per deciliter. Ketone bodies was present. Diagnosis is diabetic ketoacidosis. Treatment is IV fluids with regular insulin. Next case is a female patient presented with unilateral headache associated with nausea, photophobia, phonophobia. Diagnosis is acute attack of migraine. Drug of choice is sumatriptan. Next case is Hypertensive patient who is non-compliant with medication came with sudden onset of breathlessness. Chest X-ray showed increased interstitial markings, vascular redistribution, alveolar edema in butterfly pattern. Diagnosis is acute cardiogenic pulmonary edema. Treatment is IV nitroglycerin. Next case is CSF of patient showed cobweb-like clot. Slide shows lymphocytic predominance. Diagnosis is tubercular meningitis, which is caused by Mycobacterium tuberculosis. Next case is a patient is diagnosed to have retropositive, started on highly active antiretroviral therapy. To monitor treatment efficacy is viral load. Next is patient on antidepressants came with hypotension. ECG showed wide QRS complex as well as right axis deviation. Diagnosis is tricyclic antidepressant toxicity. Treatment is IV sodium bicarbonate. Next case is 25-year-old patient came for tooth extraction for dental caries. Atrial septal defect is not considered as high-risk condition that warrants prophylaxis against infective endocarditis. Prophylaxis against infective endocarditis is given for prior history of endocarditis, prosthetic heart valves, unrepaired cyanotic heart disease. Next case is patient came to emergency department with history of ingestion of 10 tablets of paracetamol. Oliguria was present. LFT showed deranged values. Diagnosis is paracetamol toxicity or acetaminophen toxicity, which is managed with NEC, that is N-acetylcysteine. Next case is patient came with fever, night sweats, bilateral facial nerve palsy. Investigation showed leukocytosis as well as bilateral hilar lymphadenopathy. Diagnosis is sarcoidosis. Two syndromes associated with sarcoidosis are Lofgren syndrome as well as Mikulicz syndrome. Lofgren syndrome is characterized by erythema nodosum as well as hilar adenopathy. Mikulicz syndrome is characterized by bilateral involvement of parotid submaxillary and sublingual glands. Next case is 35-year-old female has fever, breathlessness and cough with expectoration. CT scan showed sharply demarcated homogeneous consolidation that crosses segmental boundaries. It involves only a single lobe. Diagnosis is lobar pneumonia. Most common organism in community acquired adult bacterial pneumonia is Streptococcus pneumoniae. Next case is a female patient presented with negative urine pregnancy test came with galacturia. MRI showed large pituitary tumor. If patient not willing for surgery, best drug of treatment is bromocriptine. Diagnosis is prolactinoma. In prolactinoma, prolactin level will be more than 200 microgram per liter. Next case is lab investigation of a patient being evaluated for jaundice showed increased bilirubin as well as increased ALP levels. Levels of remaining liver enzymes were normal. Diagnosis is obstructive jaundice. Next case is a woman presented with fever, ulcers, arthralgia, fatigue for past 6 months and new onset hematuria was present. Urine examination showed RBC cast as well as proteinuria. Diagnosis is lupus nephritis. Next case is a patient came with irregular pulse 120 per minute. Pulse deficit is 20. Diagnosis is atrial fibrillation. JVP shows absent A wave. Atrial fibrillation is the most common sustained arrhythmia. Next case is patient presented with history of CLD. Patient had abdominal distension, jaundice as well as pruritus. Ascitic fluid is to neutrophil count is more than 650 per cubic millimeter. Diagnosis is spontaneous bacterial peritonitis, which is a acute bacterial infection of ascitic fluid. Treatment includes paracentesis as well as third generation cephalosporins such as cefotaxime. Next case is 11-year-old child with history of streptococcal pharyngitis presented with fever, arthralgia, no past history of rheumatic heart disease or features of carditis or valvular disease. Secondary prophylaxis after an episode for patient weighing less than 27 kg is 6 lakh IU of benzathine penicillin injection, which is given once every 3 weeks for 5 years or till the age of 18, whichever is longer. This case is about acute rheumatic fever which is caused by group A streptococcal infection. Normal pH is 7.35 to 7.45. Normal PaCO2 is 35 to 45 mm mercury. Normal HCO3 is 22 to 26 milliequivalents per liter. Normal PaO2 is 75 to 100 mmHg. Respiratory alkalosis is seen in high altitude states, cardiac failure, salicylate anemia. Metabolic acidosis is seen in lactic acidosis, diabetic ketoacidosis, starvation, renal failure. Metabolic alkalosis is seen in Liddle syndrome, hypertrophic pyloric stenosis, massive blood transfusion, cystic fibrosis. Normal anion gap metabolic acidosis causes are fistula pancreatic ureterosigmoidostomy, small bowel fistula, extra chloride that is hyperalimentation, diarrhea, carbonic anhydrase inhibitor like acetazolamide, Addison's disease, as well as renal tubular acidosis. Next case is a man on diuretic had vagueness, ECG done which showed flat T waves as well as prominent U waves. Diagnosis is hypokalemia, which is defined as plasma concentration of potassium below 3.5 milliequivalents per liter. ECG changes in hypokalemia include ST depression, prominent U waves, prolonged repolarization. Pseudo P pulmonale waves are also seen in hypokalemia. Common causes of hypokalemia include metabolic alkalosis, diarrhea, use of diuretics, starvation, beta-2 agonist. Next case is a male patient came to emergency department with ABG report showing pH 7.2, PCO2 is 81 mmHg, HCO3 showing 40 milliequivalents per liter. Here pH is reduced, PCO2 is increased, HCO3 is increased. Diagnosis is respiratory acidosis. Treatment is tracheal intubation, assisted mechanical ventilation. Causes of high anion gap metabolic acidosis are methanol, uremia, which is due to acute or chronic renal failure, diabetic ketoacidosis, paraldehyde, iron tablets, isoniazid usage, lactic acidosis, ethylene glycol, salicylate usage. Men 1 consist of pituitary tumors, pancreatic tumors, parathyroid tumors. Men 2A, which is also known as Sippel syndrome, consists of medullary thyroid carcinoma, pheochromocytoma, parathyroid tumors, mainly adenoma. Men 2B, which is also known as Men 3, includes medullary thyroid carcinoma, pheochromocytoma, mucosal neuroma, marfanoid habitus, megacolon, as well as medullated corneal nerve fibers. Next case is patient with coronary artery disease had chest pain as well as palpitation. ECG showed wide QRS complex tachycardia with absent P waves. Diagnosis is ventricular tachycardia. Treatment is IV amiodarone, which belongs to class 3 antiarrhythmic group. Multi-drug resistant TB shows resistance to isoniazid as well as rifampicin. A child came with history of injection of 10 to 20 ferrous sulfate tablets. ABG showed acidosis. Iron toxicity is seen from above case, which is treated with deferoxamine, which is also known as desferrioxamine. It is given as intramuscular route. Next case is patient presented with fever, jaundice as well as malaise. HbSAg showed positive. Anti-HbS is negative. Anti-HbC IgM is positive. Anti-HCV antibody is negative. Diagnosis based on serology is acute hepatitis B. Next case is 37-year-old female patient has headache for 6 months. She is taking analgesics regularly. Headache increased on severity for 3 days but reduced on stopping analgesics. Diagnosis is medication overuse headache, which is also known as analgesic rebound headache or drug-induced headache or medication misuse headache. Tension headache is chronic headache syndrome characterized by bilateral tight band-like discomfort. Cluster headache is retroorbital. It has a deep, excruciating, non-fluctuating pain. Next case is 68-year-old male patient complains with cough with yellowish sputum. Auscultation showed bronchial breath sounds. Patient was hemodynamically stable but not confused. On examination, respiratory rate is 20 per minute, BP 110 by 70, urea is 44 mg per deciliter. Diagnosis is community acute pneumonia. This patient is considered for admission in a non-ICU setting. To determine need for hospitalization in CAP, that is community acute pneumonia, is based on CURB 65 score, that is CURB 65 score. In this question, patient has no confusion. Urea is 44 mg per deciliter, which gives score 1. Respiratory rate is 20 per minute, BP is 110 by 70. Age is 68 years, so score is 1. So in this question, CURB score is 2. CURB 65 score, if it is 0, it is treated as OP case. If the CURB 65 score is 1 or 2, patient is admitted to hospital. If CURB 65 score is 3 or more, patient is admitted in ICU. CURB 65 criteria includes confusion, blood urea nitrogen more than 7 millimole per liter, respiratory rate more than or equal to 30 per minute, BP, that is systolic BP less than or equal to 90 mmHg and diastolic BP less than or equal to 60 mm mercury, age more than or equal to 65 years. Next is woman with hysteria was hyperventilating. She developed carpopedal spasm. Cause is respiratory alkalosis. Next case is 10-year-old child with recurrent pulmonary infections showed bulky greasy stools. Quantitative estimation of stool fat was more than 10 gram per day. Diagnosis is cystic fibrosis. Distal intestinal obstruction is seen in this child. Next question. A diabetic woman complains of vomiting. She gives history of consuming food from outside. On evaluation, BP is 90 by 60 mmHg. APG report shows following findings, that is pH 7.52, HCO3 30 milliequivalents per liter, PaCO2 is 20 mmHg, sodium is 123 milliequivalents per liter, potassium is 3.2 milliequivalents per liter, chlorine is 67 milliequivalents per liter. Cause of ABG finding is persistent vomiting because patient has hypovolemic, hypochloremic, hypokalemic, hyponatremic metabolic alkalosis with respiratory alkalosis. Next case is 36-year-old female patient shows claudication in forearm. There is transient loss of vision, abdominal pain, femoral pulses were weak, fundal examination showed retinal hemorrhages. Diagnosis is Takayasu arthritis. Investigations include arteriography. Arteriography is done as confirmatory test. Treatment is by glucocorticoid therapy, methotrexate, immunotherapy with anti-TNF agents, as well as surgery of stenosed vessels. Next case is patient presented with fever, nocturnal cough, breathlessness, and wheezing for 4 weeks. Absolute eosinophilic count is more than 5000 per microliter. Chest X-ray showed miliary pattern. Diagnosis is tropical pulmonary eosinophilia, which occurs in response to trapped microfilaria within lung parenchyma. There is type 1 hypersensitivity reaction here. Treatment is by DEC at daily dosage of 4 to 6 mg per kg into 14 days. Next case is 10-year-old child presented with AIDS, has fever as well as productive cough. On auscultation, bronchial breath sounds and crepitations are heard in right infrascapular region. Chest X-ray showed right lower lobe consolidation. CD4 count is 55 cells per millimeter cube. Diagnosis is lobar pneumonia. Most common organism causing lobar pneumonia is Streptococcus pneumoniae. Next case is a middle-aged man with chronic renal failure on dialysis had sudden collapse to casualty with labored breathing. ECG showed tall tented T waves. Most likely acid-base imbalance seen in this patient is low pH, that is less than 7.35, low H2CO3 less than 22 milliequivalents per liter, low PCO2 less than 35 millimeter mercury. Next case is a woman came with numbness of fingertips. On examination, her face is tightened. Anti-nuclear antibody is positive. Immunofluorescence showed nucleolar pattern. Diagnosis is systemic sclerosis, which is also known as scleroderma. Next case is 45-year-old female patient came with history of hypertension with loss of consciousness, chest pain, diaphoresis. On examination, she was grossly unstable. Bilateral pulses were unequal. ECG showed non-specific STT changes. Diagnosis is aortic dissection as patient is hemodynamically unstable. Best investigation is transesophageal echo. Next question. Patient who is a known case of atherosclerosis underwent circumflex artery bypass. Stent is now placed successfully. He is already taking lisinopril, verapamil, metoprolol. Drug added here is P2Y12 receptor blocker to inhibit stent thrombosis. Example of P2Y12 receptor blocker is clopidogrel, which is added with aspirin. It is known as dual antiplatelet therapy. Next is pheochromocytoma. It is diagnosed by urine VMA and catecholamines. Pheochromocytoma, definitive treatment is surgical excision. Pheochromocytoma can present as hypertension alone and sometimes with vomiting as well as pain abdomen. Alpha blockers like phenoxybenzamin is given initially to manage hypertension in pheochromocytoma. Investigation of pheochromocytoma include measurement of urinary as well as plasma levels of catecholamines and metanephrines. Next investigation is MRI. Treatment for pheochromocytoma include surgical resection of tumor, which is definitive treatment. Pre-operatively, hypertension is treated with alpha blockers followed by beta blockers. Post-operatively, lifelong yearly follow-up should be done. Next case is patient presents with seizure. On examination, urine osmolality is 1000 milliosmol per kg. That means urine osmolality is increased. Normal urine osmolality is 500 to 800. And in this case, serum osmolality was 270 milliosmol per kg. That means serum osmolality is low in this case. Normal serum osmolality is in between 285 to 295. So in this case, patient had seizure along with urine osmolality elevated and serum osmolality decreased. This is seen in SIADH as well as hyponatremia. Next case is a male patient. He had feeble femoral pulse with unilateral BP of 186 by 90 mmHg. Chest X-ray showed enlarged intercostal arteries. Diagnosis is coarctation of aorta. X-ray findings of coarctation of aorta is figure 3 sign as well as notching of ribs. Notching of ribs is known as Rosler's sign. Next case is 50-year-old man presented with history of recurrent retrosternal chest pain with each episode lasting for 3 to 5 minutes, subsiding with sublingual nitrite. ECG finding showed left ventricular hypertrophy, flat T wave. Patient is a known case of hypertension, diabetes mellitus, hypercholesterolemia, currently on aspirin, atenolol, metformin and also lovastatin. Diagnosis is acute coronary syndrome. Treatment is injection enoxaparin. Next case is patient with giant cell arthritis had headache, jaw claudication, polymyalgia rheumatica, mononeuritis multiplex. First line treatment for patient is steroids. Next case is patient with complaints of lethargy, increased sleep as well as weight gain. Investigation showed low plasma TSH concentration, but on administration of TRH, TSH level got increased. Diagnosis is hypothyroidism due to disease in hypothalamus. Next case is child Dercot fugue class for patient has serum albumin of 3 gram per deciliter. So the score is 2. Serum bilirubin was 2.5 milligram per deciliter. So the score is 2 again. Prothrombin time was increased by 5 seconds. That means INR is 2. And again the score is 2. There is no encephalopathy in this patient. So the score is 1. Mild ascites was present. So the score is 2. Adding up all the scores, it was showing 9, which belongs to child Dercot fugue class B. Child Dercot fugue class consists of class A, class B as well as class C. Class A means there will be 5 to 6 points. Class B consists of 7 to 9 points. Class C consists of 10 to 15 points. Class A, there will be well compensated case which consists of 10% mortality. Class B has decompensated and functional compromise which has 30% mortality. Class C consists of severely decompensated which includes 75 to 80% mortality. Next case is 60-year-old male patient who is a known case of COPD of acute exacerbation is admitted to ICU. Non-invasive positive pressure ventilation is given, which is the first mode of ventilation used in COPD patients with respiratory failure. Next case is an elderly woman with complaints of behavioral change and history of multiple falls, dementia as well as urinary incontinence. Diagnosis is normal pressure hydrocephalus. Triad of normal pressure hydrocephalus includes dementia, urinary incontinence as well as history of multiple falls. 30% of polyarthritis nodosa or 1/3 of polyarthritis nodosa cases are associated with hepatitis B. Fluent type of aphasia is seen in lesions of posterior part of superior temporal gyrus. Thrombocytopenia, eczema, recurrent infections, all these are seen in Wiskott-Aldrich syndrome. It is an X-linked recessive disease due to mutation in WASP gene. Esophageal dysmotility is seen in limited cutaneous systemic sclerosis. Water hammer pulse, which is also known as Corrigan's pulse, is seen in aortic regurgitation. Slowing of conduction in multiple sclerosis is due to loss of myelin sheath. Shock is seen in pituitary apoplexy. Next case is 20-year-old male patient has respiratory distress, hypotension following trauma. He has subcutaneous emphysema, absence of air entry into right side of lungs. Diagnosis is tension pneumothorax. Next best step is needle decompression at 5th intercostal space anterior to mid-axillary line. In children, 2nd intercostal space in mid-clavicular line, which is the site for needle decompression. Next case is ABG of patient showed pH 7.30, PaCO2 30 mmHg, HCO3 10 milliequivalents per liter. Hypoventilation causing decreased CO2 washout is suggestive of partially compensated metabolic acidosis. Next case is 70-year-old male patient who is a known case of diabetic mellitus as well as hypertension, who is on regular medications, presented with history of progressively worsening dyspnea on exertion. On examination, there is elevated JVP, hepatojugular reflex is positive, crackles are heard at lung bases, pedal edema present, ascites as well as hepatomegaly is present. Diagnosis is heart failure. 53-year-old female patient underwent hip replacement surgery. A week after surgery, patient developed swelling of legs associated with pain on palpation. Pain on palpation is known as Moses sign. Swelling of legs associated with pain on palpation, this is the feature of DVT. In this case, patient had heart rate of 70 beats per minute, no history of hemoptysis or weight loss. There was no previous history of pulmonary embolism. According to this case, risk of developing pulmonary embolism in patient based on Wells score is high. Recommended temperature of water bath in a patient with frostbite is 37 degrees Celsius to 40 degrees Celsius. Circulating water is preferred for treatment. Mutation in gene for aquaporin channel leads to nephrogenic diabetes insipidus. Focal oligemia is not radiological feature of left cardiac failure. Focal oligemia is seen in pulmonary embolism. Focal oligemia is also known as Westermarck sign. Radiological feature of left cardiac failure includes curly B lines, increased venous blood in lung, change in upper lobe circulation. Next case is 15-year-old female patient has fatigue, chronic diarrhea, weight loss, bone pain as well as abdominal distension. Investigations done showed patient had iron deficiency anemia as well as osteoporosis. Diagnosis is celiac disease or gluten sensitive enteropathy. Single best test for celiac disease is checking serum for presence of IgA tissue transglutaminase antibody. Next case is 55-year-old male patient has tachypnea and also mental confusion. Blood sugar was 350 mg per deciliter. pH is 7.2. H2CO3 is 10. PCO2 is 30. Primary metabolic abnormality is metabolic acidosis with partial respiratory compensation. Next case is 10-year-old boy came to OP with fever, swelling of hands after playing football. He gives history of previous episode of swelling of hands, which is known as dactylitis. On imaging, spleen was shrunken due to autosplenectomy or splenic infarction. Diagnosis is sickle cell anemia. It is a autosomal recessive condition. Next case is 60-year-old man presented with an episode of acute onset dizziness and loss of consciousness which lasted for few seconds followed by regain of full consciousness. No similar history in the past. ECG is done to rule out atrial fibrillation, supraventricular tachycardia, sinus node dysfunction. All these three constitute arrhythmia. ECG is done to rule out structural cardiac abnormalities also. Diagnosis is syncope. Next case is 12-year-old child having type 1 diabetes mellitus presented with confusion and drowsiness. His mother gives history that child seems to be breathing very fast. On examination, mucous membranes are dry. BP is 70 by 50 mmHg. Random blood glucose shows 415 mg per deciliter. Urine ketones shows 4 plus. Diagnosis is diabetic ketoacidosis. Best step in management is doing ABG. Next case is an unconscious patient who is hemodynamically unstable. That means systolic BP is less than 90 mmHg or mean arterial pressure is less than 65 mmHg. ECG showed narrow QRS complex tachycardia with regular RR interval and absent P waves, characteristic of paroxysmal supraventricular tachycardia. Next step in management is QRS synchronized DC cardioversion. Nasal polyps are commonly associated with intrinsic asthma. Encephalopathy attributed to HIV, invasive cervical cancer, and Mycobacterium tuberculosis of any site. These three are AIDS defining illness. Oral candidiasis is not an AIDS defining illness. Candidiasis of the esophagus, trachea, bronchi, and lungs are AIDS defining illness. AIDS defining illness are specific opportunistic illness in patients with AIDS, which signify an advanced stage of illness, that is stage 3. Next case is a 47-year-old man with a diagnosis of acute myeloid leukemia with a blood type O negative blood group presents to transplant clinic to discuss proceeding with an allogenic stem cell transplant. In this case of acute myeloid leukemia, allogenic stem cell transplants are the treatment of choice. His HLA identical 50-year-old brother who is blood type O positive would be the best choice. Next case is a 30-year-old HIV positive man presents with fever for 3 weeks, dry cough and significant weight loss. He complains of retrosternal chest pain that is worse on inspiration. Chest X-ray showed diffuse interstitial infiltrates and symmetric perihilar involvement. The most likely diagnosis is pneumocystis jirovecii pneumonia. Guillain-Barré syndrome is an inflammatory condition. It is a demyelinating disorder. Plasmapheresis is a treatment method. Ascending paralysis is seen in Guillain-Barré syndrome. The best treatment for the relapse of immune thrombocytopenic purpura is splenectomy. Left atrium is the first cardiac chamber to get enlarged in mitral stenosis. It is due to the pressure overload of left atrium. It can be appreciated on the lateral and left anterior oblique views. Components of MELD, that is model for end-stage liver disease scoring system, are creatinine, bilirubin, international normalized ratio, serum sodium. Components of CTP score, that is child Tercott Puig score, are albumin, bilirubin, INR, ascites, encephalopathy. MELD score is used to assess and prioritize patients awaiting liver transplantation. Next case is a 40-year-old male patient came to emergency department with complaints of weakness, paresthesia and breathing difficulty. ECG showed depression of ST segment, decrease in amplitude of T wave as well as increase in amplitude of U wave. These all are characteristic of hypokalemia. Osborn waves in ECG are seen in hypothermia. Osborn waves can also be seen in severe hypothyroidism. But even in those cases, hypothermia is the reason for the appearance of Osborn waves. Insulin levels are increased in obesity. It stimulates the synthesis of fatty acids and triacylglycerides and decreases the rate of lipolysis. Thyroxine, growth hormone and adiponectin have lipolytic effects. Hence their levels are reduced in obesity. Next question is, ECG shows wide QRS complex with abnormal morphology and absence of P waves, suggestive of ventricular tachycardia. In trigeminal neuralgia, pain is along V2 and V3 divisions of trigeminal nerve. Trigeminal neuralgia is more common in females. There is no objective signs of sensory loss. Trigeminal neuralgia is associated with superficial pain and no deep-seated pain. Lead pipe appearance is seen in ulcerative colitis. This appearance is due to the loss of hostra in the diseased colonic segment. Transmural involvement, rectal sparing, and perianal fistula, all these three are found in Crohn's disease. Acute inflammatory demyelinating polyneuropathy, that is AIDP, it is the most common type of Guillain-Barré syndrome. Cushing's ulcers are seen in patients with head injury. They can also be seen in case of space-occupying lesions such as intracranial tumors. The most common areas affected are acid-producing areas of the stomach, mainly fundus and body. Stress ulcers are observed in severe burns patient known as Curling's ulcers. They are usually seen in the duodenal mucosa and are related to reduced perfusion and ischemia. Stress-related gastric ulcers, most common presentation is minimal GI bleeding. Deficiency of CD55 and CD59 is seen in paroxysmal nocturnal hemoglobinuria. Next case is a patient with rheumatoid arthritis is being treated with methotrexate and low-dose corticosteroids for the past 4 months. However, the disease is still progressing. For further management of patient with rheumatoid arthritis with worsening disease activity, the preferred therapy is a step-up to oral triple therapy with methotrexate, sulfasalazine and hydroxychloroquine. Next case is a young lady with fever, oral ulcers and photosensitivity showed well-demarcated erythematous butterfly-shaped rash over the malar eminences with sparing of the nasolabial fold, that is malar rash. The clinical presentation along with the malar rash points to a diagnosis of systemic lupus erythematosus. The murmur of hypertrophic cardiomyopathy, that is HOCM, increases with standing. The murmur heard in hypertrophic cardiomyopathy is mid-systolic murmur, which is loudest along the left sternal border. It increases in conditions of decreased preload and afterload or conditions of increased contractility and decreases when preload and afterload are increased. Decreased preload and afterload is seen in standing position, Valsalva maneuver as well as vagal maneuver. Increased contractility is seen in inotropic stimulation. Preload and afterload are increased in squatting position as well as when using vasopressors. On performing a pulmonary function test, reduction in FeV1 by FVC is characteristic of obstructive disease. Calcitonin levels are increased in hyperparathyroidism. Sepsis, transfusion-related lung injury, and fat embolism syndrome following femur shaft fracture. All these lead to acute respiratory distress syndrome at blood-lung interface. Pneumonia leads to acute respiratory distress syndrome at air-lung interface. Thrombosis of posterior inferior cerebellar artery causes lateral medullary syndrome or Wallenberg syndrome. Pica is a branch of fourth part of vertebral artery, which is a branch of first part of subclavian artery. Next case is a patient presents with frequent urination, nocturia and enuresis. 24-hour urine volume was measured and recorded to be 7 liters. The urine osmolarity was 260 milliosmol per liter. ADH assay was performed and the recorded values were reported as 0.8 picogram per milliliter. MRI of the brain was performed and T1 weighted indicated the absence of bright spot. The most common diagnosis is pituitary diabetes insipidus. The diagnosis of prolactinoma is highly seen when prolactin levels are more than 200 microgram per liter. Normal range of serum prolactin is 5 to 20 microgram per liter. Next case is a patient develops prosthetic valve endocarditis 2 years after valve replacement surgery. The most common causative organism is streptococci. The most common extra-articular manifestation of rheumatoid arthritis is subcutaneous nodule. Periodic acid shift positive macrophages are seen in Whipple's disease. According to Berlin definition, moderate acute respiratory distress syndrome is characterized by PaO2 by FiO2, which is in between 101 to 200 millimeter mercury, bilateral interstitial infiltrates, symptom onset within a week, no cardiac failure on echocardiography. Low serum copper levels attributed to ATP7A gene is due to Menkes disease. Next case is a patient presented with cutaneous vasculitis, glomerulonephritis and peripheral neuropathy suggestive of small vessel vasculitis, investigating for ANCA, that is anti-neutrophil cytoplasmic antibody, should be the next step to aid in diagnosis. Approximate time interval between HIV infection and manifestation of AIDS is 10 years. Myasthenia gravis is associated with decreased synaptic transmission at the myoneural junction. Weber's syndrome consists of contralateral hemiplegia, contralateral Parkinsonism, ipsilateral oculomotor nerve palsy, contralateral paralysis of lower face. Weber's syndrome is caused by infarction in the distribution of the penetrating branches of the posterior cerebral artery. It affects the cerebral peduncle, especially medially, with damage to vesicle of cranial nerve 3 and the pyramidal fibers. Next case is a 10-year-old boy complains of multiple episodes of acute severe pain in his fingers and toes, which resolves on its own for the past 1 year. The features of multiple episodes of acute severe pain in fingers and toes with spontaneous resolution is suggestive of dactylitis, that means hand-foot syndrome, which usually occurs in sickle cell anemia. Cryoglobulinemia is associated with hepatitis C. Brown-Sequard syndrome presents with contralateral loss of pain sensation. Lateral hemisection of the spinal cord produces Brown-Sequard syndrome, which is also known as hemicord syndrome. Knife or bullet injuries and demyelination are the most common causes of Brown-Sequard syndrome. Next case is a child presented with hepatitis, progressive neurological degeneration and Kaiser-Fleschner ring, which is suggestive of Wilson's disease. The initial step regarding investigation done for the diagnosis is measurement of serum ceruloplasmin levels. Kaiser-Fleschner ring is a golden to greenish brown ring of deposition of copper in the Descemet's membrane of the peripheral cornea. Automatic implantable cardioverter defibrillator, that is AICD implantation, is done for Brugada syndrome, ventricular fibrillation as well as acute coronary syndrome with low ejection fraction. Automated implantable cardioverter defibrillator is a device placed in the chest or abdomen to detect arrhythmias and perform cardioversion, defibrillation and pace the heart. ICDs are indicated for primary prevention in patients who had myocardial infarction more than 40 days ago. Cardiac resynchronization therapy is done for prevention of sudden cardiac death in heart failure. Pseudo P. pulmonale is seen in hypokalemia. Gold's criteria for very severe COPD is FEV1 by FVC less than 0.7 and FEV1 less than 30%. Next case is a 35-year-old female patient has hypokalemia, hypertension and metabolic alkalosis. Most likely etiology is Liddle syndrome. In a baby born to HIV-infected mother, HIV infection is diagnosed using HIV DNA PCR. Central bronchiectasis is a typical feature of allergic bronchopulmonary aspergillosis. Other features include cough, wheezing, raised serum IgE levels. Next case is a 58-year-old male patient has been diagnosed with hypertension. On examination, there is no existing cardiovascular disease, no hypertension-mediated organ damage, and the renal function is normal. He should be immediately started with pharmacological management if his blood pressure is more than or equal to 140 by 90 mmHg. Next case is a middle-aged woman who presented with tremors, palpitations, weight loss and menstrual irregularity is diagnosed with Graves' disease. In Graves' disease, the level of serum TSH is low, free T4 is high, serum T3 is high. In patients with thyrotoxicosis, The radioactive iodine uptake at 24 hours is characteristically elevated. The observed myocardial stunning pattern does not match the ECG finding of patient. The probable diagnosis is Takotsubo cardiomyopathy. Abacavir is not used in HIV and hepatitis B co-infection. Abacavir is used in the first-line ART regimen for patients with abnormal serum creatinine values. Antiretroviral drugs used in HIV and hepatitis B co-infection include tenofovir, lamivudine, emtricitabine. A patient who is awaiting death in the hospital comes under category 3 non-heart beating donor. Hypothyroidism is associated with AV block. In hypothyroidism, there is reduced myocardial contractility and reduced pulse rate, leading to reduced stroke volume and bradycardia. Ciprofloxacin is used for chemoprophylaxis of meningococcal meningitis for close contacts.